George Kilpatrick, Inspiration for the Nation. We are pleased to be joined by Dr. Eric Griggs. He's the National COVID Director for the 100 Black Men of America and the Community Medical Director for Access Health Louisiana. So glad to see you, Doc Griggs. Among other things, Doc Griggs uses his platform to promote health awareness, not only in the state of Louisiana, but around the country. And Doc, so good to see you. You may remember Doc Griggs was part of a panel discussion that we did with the 100 Black Men of Syracuse to raise health awareness. And here we are again, someplace we thought we wouldn't be. Here we are again, Doc, talking about vaccine awareness, people who are anti-vaxxers, particularly those in the Black community. What is going on, Doc, right now as we see COVID cases rising? We see breakthrough cases, meaning people who are vaccinated becoming infected again. What's going on, Doc?
So first of all, good morning, and thank you for having me. It really is unfortunate. It's a place that we did not see coming. We thought we had this thing licked, and there were some mistakes made along the way. The messaging, we told people that if they were vaccinated, they didn't have to wear a mask, that we would go on the honor system, blah, 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 and people being people. We kind of we gave them an inch and everybody took a mile.
Yeah.
And because of that, here we are, we have a new variant, the Delta variant, which is the predominant strain, which is actually, and we'll get into it later, which is actually kind of protecting us from the other variants that are out there that are somewhat more dangerous. It's been quite a ride, and we got quite a ways to go.
Yeah, you said there were some mistakes made. Let's talk about that, because it's interesting, because right now, when I go into most indoor spaces, when I go to the supermarket, when I go to the gym, I'm still wearing my mask, and I'm fully vaccinated. I got the Pfizer vaccine back in March of this year, my second dose. And my wife, she's still not going most places, right? And so we're trying to be careful, but a lot of people, I've been to a lot of places. I've been to, where was I? I was at, I went to a play, right? But you had to have proof of vaccination. Here in New York, they've got something called the Excelsior Pass, and they're, so what's going on here? What mistakes did we make?
Part of the issue you ask about the mistakes, it's the messaging. I think we moved entirely too soon. We should not stop wearing a mask until this thing is over. And if you want to look at the effectiveness of wearing a mask, you look at our flu numbers last year. Our flu numbers were virtually zero. Why? Because a lot of people got vaccinated, but most importantly, people were social distancing and they were wearing a mask. Mm-hmm. Once we confused things, we muddied the water and left it up to us. People decided to stop wearing a mask. We started this summer, if you remember, it was like the roaring 20s.
Yeah.
We were like, we outside, we're partying, we're gonna do this. And the moment we did that, not only did the Delta virus and the numbers start to go up, but all those things that we'd avoided in last winter and fall started to surge. We had respiratory syncytial virus, RSV, which we never see and hardly ever see in the warmer months, start to spike. The hospitals were starting to, and the ERs were starting to see cases of RSV everywhere. Then again, the virus doesn't spread the virus. People spread the virus because people were so close, because they weren't social distancing. This new mutated strain of COVID-19 started to take over. And part of the reason why is because one of the reasons is we don't pay attention to what happens in other countries, and not paying attention to the descriptions of the variants. This Delta variant is 1,000 times more quote unquote concentrated than the Alpha variant, which was the B117 out of the UK, and the original strain. What does that mean? It lives in the nasopharynx, your nose and mouth, and it replicates at a rate of 1,000 to 1.
Wow.
Compared to the original strain. So every time you're talking and speaking and yelling and sneezing, and you're not social distancing without a mask on, you're putting 1,000 times the concentration potentially, if you're infected, of virus in the air for other people to breathe in.
You mentioned
1,000 times.
I'm just thinking about that, right? So that means that then even if you're vaccinated, tell me why we're seeing so many more breakthrough cases.
So here's the thing. First of all, I don't want, we've been talking about breakthrough cases. I'm glad you brought that up. I want to address it. The breakthrough cases and the breakthrough deaths they're not as high as people are saying. I think the number of deaths is, out of all the cases we've seen, is like 20, last week it was 2,670 deaths. Out of all these millions of people, out of the 650,000 deaths that we've seen, and out of the 162 million plus vaccines we've seen, we only have like 2,000 to 3,000 cases of breakthrough cases. Let's talk about that first. The second thing is that the vaccines they don't necessarily prevent you from being infected like they did with the original strain and the earlier variants, right? You can still become infected, but if you're vaccinated, you tend to have a much lower risk of dying and a lower risk of being hospitalized. This pandemic and this surge, again, is a surge of the unvaccinated. The problem, as we've talked about historically, I was in a discussion late last night with a videography historian. We were talking about how over time, even the bubonic plague, if enough people get infected, it changes its strategies, it morphs, it mutates to the point that it won't necessarily need the same host. Well, that's what this Delta variant has done. Delta is really, really deceptive, because if you remember when COVID started, we said it's dry cough, fever, shortness of breath. Right. Didn't even have anything about smell. Remember that?
Right.
Then things changed to the point that it's called anosmia or ageusia, the inability to smell or inability to taste. That was almost diagnostic for COVID-19. Well, Delta got slick. So all these people are out without a mask, they partying and chilling. Well, I'm gonna do it too, and I'm gonna make them think that they have just a sniffle or allergies. We're gonna make it if you have a sore throat, a sneeze is a headache that won't go away. That's the Delta variant, and it's not what we were looking for. So the more people that don't get infected, the more people, that don't get vaccinated, and the more people that become infected, the more likely we'll have those mutations. The more likely we have those mutations, the more likely we'll have problems with variants beyond Delta.
But yet you say, and you said you would talk about this, that the Delta variant actually is protecting us. That seems like a contradiction.
Yeah, it's oxymoronic. It's like, wait, how is this bad thing helping us out? Well, the interesting thing is nature is nature and life is life. And there's competition in everything. Right now, because of the rate and the robustness, the strength of the Delta variant, the fact that it can get in and concentrate in your nose and your mouth and spread so quickly, it's beating all the other viruses out. There are variants out. We've heard about Lambda, there's Kappa, there's Mu, and you're worried about some of them mutating past the natural resistance and the vaccine, which is a problem, because if we don't have a vaccine, we're going back to square one. But the issue is that Delta's boxing everybody out. If you're a basketball fan, it's Shaquille O'Neal, Hakeem Olajuwon, and Kareem Abdul-Jabbar, Bill Russell, and all in the same, David Robinson, all in the lane, just box. No one can get to the basket. No one else can get in. The Delta variant is like 99%. It was between 93 and 99% of the viruses that people get infected with are Delta strain, because it's literally boxing everyone out. Imagine being a little kid and someone saying, I'm going to get my big brother or my cousins, and they come back with 1,000 people. Nobody can walk on a block.
Right. Pookie and them, Dr. Eric Griggs.
Pookie and Nook them.
National COVID Director, 100 Black Men of America. So let's talk about this then. Black folk and the vaccine. Can we just do this for a minute?
Yes.
Because we're still more at risk than most populations. At least that's what I keep reading, and I'm believing that. And yet we still have vaccine hesitancy. Can you say something to us for a minute?
Yeah, I want to talk to us. Let's talk real numbers. So Black folks, we make up 13% of the population, but we make 52% of the COVID deaths. And at one point, at the very beginning of this, we made up 70% in Louisiana. 70% of the bodies showing up in the morgue looked like us. And the reason why back then, if you remember the very beginning, Black folks, we laughing, kicking, cackine at the barbershop. Yeah, bro, Black people don't get COVID because we didn't see it in our community. That ain't for us. That's for the people over in China. That's for the white folks. We don't do this, that, and the other. We say all kind of crazy stuff. And sure enough, it was wiping us out. It's the exact same thing. It's not cool to not get vaccinated. And I tell you what, We need to just stop it. We need to just stop it. This is science. Science works. We all had to get shots when we went to school. They worked. If you get sick, you know what's funny is if you get sick from COVID, and I get it all the time, if people get sick, where do they go? They go to the hospital. Why? Because they want to be treated. Why? By who? By the same people that were telling you that you need to get your vaccine. So we need to just stop it. It's our people that are dying. I lost count of how many people that I personally lost to this virus. I have 11 families right now that I'm taking care of, that I'm checking on every day, because one person got infected and then it went through the mom, the dad, and all the kids, and they're quarantining at home. It happened in my own family. My sister and her kids, I'm not doing it, I don't believe in it, and blah, blah, blah. I tell people that you're either gonna call me now to find out where to get a vaccine, or you're gonna call me tomorrow and ask where you can go, go get tested. And then you're gonna ask me what to do and pray. And once you become infected, it's too late to get the vaccine. You got to ride it out until your quarantine's up, if you survive.
If you survive. Okay, so let's talk about the vaccines, right? So we got Pfizer, which has now been FDA approved. We also understand that Pfizer has been approved for a booster shot for 65 and over. And we there's an
EUA, emergency use authorization for the booster shot. That's different.
For booster shot. Thank you. You're right. You're the expert. I'm just going to tell you what I heard, and you tell me what it is. Okay.
Tell me what they had said.
What they had said was, and then I just read something about efficacy in terms of something with Moderna having more efficacy than initially thought, than even Pfizer right now. Can you clear that up for me?
Yeah. So what I tell people is try not to get caught up in the hype of marketing.
Okay.
For a vaccine to be considered effective, the efficacy rate by the World Health Organization is 50%.
Okay.
And that's the flu shot every year is about 50 to 70%.
Right.
On some good years or bad years. And that's worked all these years. It just so happened that with the first vaccines of Pfizer and Moderna, when they gave the first shot, it got above the threshold, but let's give another shot. Let's see what happens. One got to 94, one got to 95 plus, and it was very effective with the original, those other variants. It's like what and what. I mean, if you got to have a 50 or a 70 to pass the test and you get a 90, 95, that's great. It's kind of like ego, but you don't need that much effective efficacy. The point is, both of these vaccines, all the vaccines are effective, almost 100% effective, almost, because nothing's 100%, almost 100% effective at preventing you from dying and you from being hospitalized. And that's the whole purpose of any vaccine, right? The whole purpose of a vaccine is we don't want people to die, and we don't want to overwhelm our hospital system. If you can get something like our flu, you catch the flu, you're out for a few days or a week, and then you're able to go back to work and re-enter society and not infect other people, then that's a win. That vaccine actually worked. And that's where we are. The issue with this is we're seeing too much of how the sausage is made in science.
Right.
And science is an art of failure. You have 10,000 failures and one success, and all of a sudden you're a genius? That's science. But you don't have someone documenting everything it is that you do. Imagine trying to cook or make a cake, and somebody's in the kitchen being like, "Hey, George just added an egg. Mama, he wastes some milk on the floor. He ain't got enough sugar. I mean, he in here cussing. I mean, that's what's happening."
So, lastly, Doc, what's happening in Florida? What's happening in Texas and all these other places where they don't want you to wear masks? Well, let me reframe that. What should we be doing now? Because in some of those states, they've got these cockamamie policies. I don't want to waste time on that. I want you to tell us what you think we should be doing now, including whether or not people should still get the flu shot. And I say still get the flu shot because, flu was so way down, again, more anecdotal from me, because a lot of people were doing all of these things, washing their hands and all of these things that keep you safe from COVID. So what should we be doing now, even in the backdrop in some places in the country that are fighting mask mandates, that are fighting all of these restrictions that science says works?
George, your anecdotes are spot on and on point. Whoever you got reporting and watch from the street is spot on. What we need to be doing is exactly what we've been doing from the very beginning. First of all, we want to get vaccinated, right? You definitely want to get vaccinated against COVID-19. You have people dying, getting sick every day. The other thing is you want to get the flu shot. Everything we did last year worked. It's called communicable diseases. These are diseases that can be prevented. And we showed it with the flu. You need to wear a mask. You need to social distance, meaning that if it looks too crowded and it doesn't feel right, then don't do it. Wash your hands, wear a mask, social distance, wash your hands. I cannot, and that's another flub that we made when we told people that, oh, it's not fomites, you don't have to wash your hands. Please wash your nasty hands. Please, everyone wash it. We've all been in the public bathroom and seen people walk out. Like, I can't believe that's just
word. Nasty. Yeah, I've seen it. It's true. It's true. I was like, how y'all do that?
And then it'd have to be someone that walks up and want to shake your hand. Nah, dog, I'm good.
Oh my God. You know what? Could I just tell you a funny story? This happened to me and I was like, oh my God. The older gentleman just turned around and took my hand. I was like, oh no, what did I just do? This was before COVID and all that, but I was like, yeah, you know, it was like a reflex. I was like, oh God, what did I do? Oh my God, Doc. And so even right now, so in New York, in some places, we have the recommendation, like you wear a mask, but I still see a lot of people not doing it. Your recommendation is that we continue to wear masks indoors?
Absolutely. I want you to wear a mask indoors. Remember, this Delta variant is 1,000 times the concentration. It replicates at 1,000 times that of the original strains, meaning that just as a community, we have 1,000 times, if you can imagine it that way, right? Imagine I'm talking to you and we're face to face, and imagine the virus is green. And as I'm talking to you, I got this green fog looking like nasty, funky breath coming out of my mouth. I don't want to breathe in your funky virus. I don't want to breathe in any of that. It is in respiratory droplets. We do know that masks work to contain your respiratory droplets, to decrease the amount of virus in the air. We need to wear our mask. Wear your mask, wear your mask. And again, the other thing is don't congregate. No matter what, imagine again, if you have 1,000 times the concentration in the air, whether you're vaccinated or not, and you're breathing in and laughing and talking, your body can be overwhelmed. You can still become infected. Now, again, you won't necessarily get as sick as you would or possibly die if you weren't vaccinated, but you got to wear your mask, social distance. And the other thing is, hey, stop using those bootleg cards. Stop even shopping for them, because I know it. I've had people ask me about it. You're putting in all that effort when it's just as easy to just go get the shot.
Go get the needle. Go get the shot.
Get it now while it's free. It's free. Get it now. We are going to evolve to a point. COVID's not going anywhere. We're going to evolve to a point where it's going to have to be a pay thing. I don't think that's any time in the future. Get it now while it's free. Protect yourself.
Well, and if you, Moderna says we may be another year with this pandemic. That's what I heard. What do you say, Doc?
Yeah. So what he said was, and if you heard what he said, that was the CEO of Moderna. He said that was very optimistic to think that. I think it'll be more than a year. I think we have, I believe, quite a few years, because as people, there are some countries where only 2% of the population is vaccinated. Okay. So we're all globally linked. The more we travel, the less we get vaccinated, the less we protect ourselves, the more likely there'll be variants to come. I mean, it's what's called endemic. Just like the flu, something that we've been dealing with for at least 100 years. Remember the last pandemic? Yeah. COVID's going to be around for a while. And I don't see myself not doing anything and not wearing a mask. I don't, especially travel. I just don't.
Wow. Dr. Eric Griggs is the National COVID Director for 100 Black Men of America and the Community Medical Director for Access Health, Louisiana. Doc Griggs is a bad brother, giving us the information straight, no chaser for all of us. What did he say? Let's recap. Wear a mask, social distance. You can recap it. Tell us again, Doc, so people can be clear.
First of all, get the shot. Shut up and get the shot. Vaccines work. You might be infected, but you will not die and you will not be hospitalized. If you have any questions, I'm here. Talk to your doctor. I'm here to give it to you straight. The other thing is to wear your mask. Wear your mask, wear your mask. And please wash your hands. Please wash your hands. And of course, social distance. Stay away from large crowds.
Dr. Eric Griggs, Inspiration for the Nation. Thank you so much, Doc.
Thank you.